Hi, this is Jim Osborne. I'm the Chief Clinical Officer for Triad Healthcare Network, and you're viewing a short audio PowerPoint on polypharmacy and medication adherence. We appreciate you taking the time to do this. This is a very important topic to all of our patients and all of our providers in THN, and we hope you will find this information helpful. So what is polypharmacy anyway? Polypharmacy has various definitions, and they range anywhere from as few as 2 medications to as many as 18 medications. Some people just define it as more medications than necessary. But the most common definition is polypharmacy is defined as being in a patient who is taking more than 5 medications at a time. Now, older adults actually account for about 12% of the US population, but they consume over a third of prescription medications, which makes sense because they're more likely to have chronic diseases. And of course, as you know, many patients take medications to manage multiple chronic disease states, and you might be one of those people. And recently, clinical guidelines for chronic diseases such as hypertension, diabetes, COPD, and heart failure frequently include recommendations for multiple medications added in a stepwise approach that can quickly lead to polypharmacy. But the problem here is that because so many patients use multiple healthcare providers in the management of their chronic diseases, including their primary care physician and various specialists, patients may end up getting medications from more than one doctor. In addition, patients may fill medications at multiple community pharmacies and even with a mail order pharmacy. So this leads to more and more problems over time. The result is that physicians prescribe and pharmacists sometimes fill prescriptions without knowing the entire medication regimen of a patient. And the prescribing of these medications can lead to significant drug-drug interactions. What's a drug-drug interaction? It's when two drugs interact in such a way as to cause a problem. One drug may cause another drug to work less effectively than it should. Another drug could cause another drug to work more effectively or be more likely to give side effects because of altered metabolism. Medications that are prescribed can sometimes lead to significant drug-disease interactions. And that's when the drug that's given makes another disease worse. The best example is when prednisone is given for various illnesses in a patient with diabetes. It raises the blood sugar dramatically. And of course, if you have to take a whole lot of prescription medications, this increases the likelihood that you're not going to take them all properly. And this will decrease what's called medication adherence. Now, there are other things that can lead to polypharmacy problems as well. These include herbs, vitamins, home remedies, and other supplements. So all of these over-the-counter products should be considered as medications too. So be sure to ask your pharmacist or doctor if they may interfere with your current medications. And at the very least, be sure that your pharmacist and your doctor know what over-the-counter products you're taking on a regular basis so that they can advise you on the safest course of action. There is a big debate around whether a patient should use one or more pharmacies. If you use multiple pharmacies, sometimes you might do that because one pharmacy is more convenient to you than another, and sometimes another one will have lower cost than another. And those things could actually improve medication adherence. But most people recommend that you use a single pharmacy because consistent use of a single pharmacy will usually enhance medication adherence and foster regular communication between the pharmacist and the doctor. Use of a single pharmacy also leads to less confusion for older adults with medication management issues. They might forget that they needed to go back to another pharmacy to get an important prescription. Now, what can you do to reduce polypharmacy and improve medication adherence in your life? THN recommends, as I said a moment ago, that you use one pharmacy supplier. This will increase the likelihood that the pharmacy can keep up with your medications and make it more likely that you'll stay adherent to all your medicines. We also recommend that you check with your health plan because your pharmacy benefits allow you to use 90-day fills of your medications, that is to buy 90 days at a time, then that helps medication adherence and means less trips to the pharmacy for you. There is strong evidence that when patients get 90-day prescriptions, they actually do in fact take their medications more regularly, which of course is better for them and lead to better outcomes. And of course, since problems are more likely to occur when taking multiple medications, it's always important to inform every doctor you see and any pharmacist you use of all the medications you use. And again, don't forget those supplements. Always talk to your doctor about your medications, and we recommend that you always have an up-to-date medication list with you at all times. Now, it is important that this be up to date because sometimes we will see a medication list that has a number of things that the patient's no longer taking. So be sure to keep that medication list updated with your regular medications and those supplements as well. We strongly encourage you to also know the names and effects of your medications. I know it's hard because the names of these medications are really long and complex sometimes, but learning the name of the medications is really important. If you just tell the doctor you run out of the yellow one, they're not going to know which one that is. So be sure you know the name of your medications and what they're being used for. You might want to just put that on the list of medications you make. Put the name of the medicine, the dose, the color of the medicine, and what it's for. And review that with your pharmacist and your doctor to be sure that it's correct. Another thing that leads to problems is when patients split pills. Sometimes patients split pills to try to make them last longer. But the problem with that is that can result in a number of problems. For instance, some medications should not be broken in half because of the release properties of the pill, and that can be dangerous for you. In addition, if you split pills when you take a half the dose when you should be taking the full dose, this can result in inadequate dosing of your medications for your problems. And we also advise you not to ask your doctor to write your prescription for whole tablets with the intent of splitting them. This is actually fraudulent, and more importantly, it can be dangerous to your health. How can that happen? Well, medical records are often sent from provider to provider as you move through the health system and get your care from place to place. And if the medication entry is incorrect, this can lead to serious outcomes. So don't ask your doctor to write a prescription for whole tablets with the intent of splitting them. Have them written and take them as directed. So in conclusion, THN recommends that you only use one pharmacy, and for chronic medications, be sure to get 90-day fills for your prescriptions. Keep your doctor and pharmacist informed of all your medications, including your over-the-counter medications. And we advise you to know the names and effects of your medications, and on that updated list of medications you keep, be sure to write those on there so you'll know what they are used for. And finally, take your medications as directed. It's better for your health. There's a good reason why your providers prescribe these medications for you. It's been shown to help your outcomes. We appreciate you watching this short video on polypharmacy and medication adherence. If you have any questions, please reach out to your doctor or pharmacist. Thank you so much.